welcome in everybody to a special edition of PharmCast for the community. I'm your host, Dr. Tim Brown. We're coming to you from the University of Georgia's College of Pharmacy. And in discussion before the holidays, I really sat back and thought, what would I like to do for January? And as you guys know, we posted a cast talking about smoking cessation with Miss Kay Brooks, who was awesome. But then I started thinking, one of the hottest topics in the world right now is how do we live and survive COVID-19? And the vaccine is getting a lot of play out there, and you're hearing a lot of people talk in these big, highfalutin jargon terms. And I thought, no, let's bring it out for the community and let's talk about this in terms that everybody can understand. So we have an idea of what we're facing with the vaccine, but also what the vaccine actually means to us in the community. So to do that, I brought on two of the coolest people at UGA that have been involved up to their eyeballs in COVID from the very beginning and have been working so hard for the state of Georgia and their citizens. I have Dr. Daniel Chastain. Daniel's been with us before. You guys recognize him. He works in infectious disease in Albany and also an assistant professor for the University of Georgia. He's an infectious disease specialist, as I mentioned, but Daniel also has a great way of taking the complex and making it easy to understand. Welcome, Daniel.
Thanks for having me.
No worries. And secondly, I have Dr. Ashley Hainings, and I'm losing my voice, guys. I promise it's not COVID. I promise. I have Dr. Ashley Hainings, who's an associate director here at the college as well. She oversees of what we call our placement for our students early on in their career so they can get experience out there before they go on to become pharmacists. But in relation to what we're talking about today, Dr. Hannings has been instrumental in dealing with the coordination of the college's immunization program. But in the wake of vaccine for COVID, Ashley, you've been working a great deal across the state in this rollout mechanism and what Georgia's going to do with all the vaccine that we're going to get at various points for our citizens, correct?
I think you're giving me a little bit too much credit, but thank you.
No, these guys are rock stars. And I brought them on because all of us are pharmacists. And I think our biggest point is if we were talking to family members, we would want to tell them about the vaccine and kind of why it's good and things to watch out for. And to sort of get us started, because it's been a year. Can you believe it? Really, March 13th is when UGA went to sort of an off-campus virtual teaching environment. So we're sitting right almost at a year from when everybody sort of started to go indoors, if you will. And we've waited breathlessly, but I have to admit to you, I'm kind of surprised. Within the course of a year, a little less than, we had vaccines come on the market, which in the pharmacy world, it's unheard of to see drugs and vaccines make it to the market that quickly. Does that scare y'all that the vaccine came on so fast?
Well, that's a really logical question because it is highly unusual. Typically, it takes years to get a vaccine to the market. And I think that's one of the reasons why people kind of have concerns about it is how in the world did they make it happen this quickly and how could it still be safe? And one of the main explanations that I would give for that would be, we did have a project called Operation Warp Speed. And with that program, the government provided financial support to some of the manufacturers to help them rev up production quicker. And so there was a huge financial risk that was taken to make it happen faster. But the trials that had been done still had a large number of people in them. And so, I don't have any particular concerns from an efficacy safety standpoint, but money kind of helped make it happen.
Well, and that's a great point that there was a lot of research that threw into this. The administration really worked hard trying to get money to the industry to go. But Daniel, I know being an infectious disease specialist, the way these vaccines were created, it's a little bit different than what we're used to, but it was already in the research process to begin with, right? So this wasn't like we created it from scratch. It was already up and running and they just sort of molded it, if you will, to this virus.
Right, exactly. The mRNA vaccines or the messenger RNA vaccines have been around for quite some time and have mostly been toying around in HIV vaccines. Unfortunately, we have not made a lot of headway in HIV, but we were able to utilize that same technology and some of the things that we already knew about the other coronaviruses to help speed this process along. And I think the other thing that Ashley made a really good point in terms of financial, but you also have every major drug company essentially under the sun, all focused on one individual target. And so I think it brought a lot of really cool collaborations between companies that we may not have seen if this hadn't have taken place.
So this messenger RNA, that's kind of, highbrow, right? I mean, leave it to Daniel with his brain and IQ to bring that in. But that's a good point, because they work with sort of the genetic messaging in the virus, right? They turn the virus. How does that work? Does it turn the virus on itself, or how does the body react to that?
So it essentially, what it's doing is it's taking part of the virus itself, and it's inserting it into your long-term immunity cells, if you will. We can refer to them as B cells and T cells, but long-term immunity. And so that way, if you ever encounter this virus again, it's able to detect it much faster with a high level of specificity.
So in other words, we get our cells ready for battle by showing it what's going to attack.
Exactly. We go from, for lack of a better word, the mall cop or the security guard, the parking lot security guard, to, special forces.
So I like that. It peps up the body and gets it ready. And now I know that right now, if I'm not mistaken, there are 2 vaccines, right? You guys correct me if I'm wrong.
Correct.
They both work under the same kind of premise that we're talking about, but yet they're not the same. You can't interchange them. One is not the generic of the other and vice versa. Is that correct?
Correct.
So Ashley, I guess the question that I want to ask is, here in Georgia, we hear about Operation Warp Speed, people getting the vaccine here or there. How do we know which vaccine is going to come to Georgia? Does it equal from both of them, or do we just get one type? Or I guess if I were the patient, I'd want to know which one I'm getting.
So that's a great question. And we see supplies of both of those vaccines in the state of Georgia. So the federal government has been allocating supply of both of those to the states, and then the states divvy them out from there. And every state, I believe, is getting a combination of the two, because there are some differences as far as storage. The Pfizer vaccine, you have to have special facilities, a special freezer to do that. The Moderna, it still is frozen, but the freezer that can hold it's a little bit more widely available. So we kind of are using a combination everywhere. If you'd like to track how many doses have been allocated to Georgia of each one, the Georgia Department of Public Health website does have a status report where it outlines that information, how many have been allocated, how many have actually been shipped to Georgia, as well as how many have been administered so far. And that dashboard that's there gets updated every day. So it was fairly evenly split between Moderna and Pfizer as far as how many doses our states are getting as of now. Georgia's getting a little bit more Moderna than Pfizer, but it's not too much different.
So, the bougie self that I am, I'm going to ask you, which one's better? I mean, should I go in and go, no, I want the very best. I want this vaccine. Or are they both the same? I mean, can I trust both of them the same? I mean, we talked about the research, but I just want to, since they're different, is there any lesson that maybe one's more potent than the other?
Well, the efficacy data was very similar between the 2 vaccines. So even though they're not quite the same thing, they're both very good. I personally, when I went over to the health center where I got mine, they stocked both. I didn't even ask, oh, may I have this one versus this one? I took them both equally. So I happened to get the Moderna, but I just as easily could have gotten the Pfizer, and I would have been fine either way. I don't know if Daniel has an opinion on that.
No, I'll take whatever we can get, to be honest with you. We had Pfizer in Albany. And so I've been through both first and second doses and can live to tell about it. So I think, as we see here, both are safe and efficacious.
So that brings me a good point, Daniel. You bring it up. So obviously, we all know that it's more than one dose. For those who maybe don't know that, there is one dose. You have to get a second dose because it boosts the immune system. So I start with Pfizer. If I go back and they're like, oh, tough luck, we're out of Pfizer today, can I get a Moderna, or does it have to be the same maker of the vaccine for both my shots? Daniel, go ahead.
Based on all the data we have, it should be the exact same first and second dose. And it's not to say that never may be a possibility, but it's never been looked at if you can interchange one versus the other on the back end. And so it would be most ideal if you got Pfizer the first time to get it, Pfizer the second time, Moderna the first time, Moderna the second time.
so if it's Pfizer, how much time do I have between my first dose and my second dose?
The interval is 21 days, so
3 weeks. Yeah.
And then Moderna is 4 weeks, or 28 days. Historically, and that was all based on ideally making sure that the antibodies, the protective part of your immune system that the first dose gave you was still hanging around, and we could just boost it with the second one, taking essentially an exponential increase in our protection. And so that was based on the trial design and those 2 timeframe intervals. Actually today, I got an email from the CDC saying that they have given us a little bit more leeway in terms of when that second dose can fall into play. And again, in the most ideal situation, we get it on that 21 or 28 day mark. But if something happens, if there are delays and you can't get to the facility to get it, or if it's just not your day and you're not feeling it, whatever it may be, then there's recommendations that we can push it out to 6 weeks for that second dose.
So the window went a little longer then.
Right, exactly. So we have some flexibility, but to go back to what Ashley mentioned, and then being very good, that's 94-95% efficacy. It's ideal that we get it on either a 21 or 28 day mark from a follow-up perspective.
So I'm going to tell the community out there, if when you get your first dose, you really should push them to put you on the schedule for your second dose. So if they have that capability, you should set up your second dose before you leave your first appointment. Is that fair to tell the community to push for that a little bit?
Absolutely.
Yeah,
go ahead, Ashley.
There are some facilities that are going ahead and making your appointments when you come in for your first dose. And I've even seen some facilities, and I really like this idea, they have people sign up for both their first and second appointment at the same time.
Got it.
And on that particular site that I'm talking about, there was a notation saying, if you cannot come to both of these dates, please select another one. And so there are some places that are being very proactive in ensuring that everyone who's coming through their door has both appointments made. But there are some sites that aren't doing that right away and are saying like, okay, well, we'll give you a call later to schedule. So it does vary from facility to facility, but I would certainly encourage people to ask about it.
Yeah, and go in the door with your schedule in your hand so you know
yes,
that 21 or 28 days from now, you're free on the whatever day that is. To Daniel's point, the closer you can get to that is better. But now we know there's a little bit of a window in there in case you have issues with childcare or work or transportation, those things. So that's awesome. Well, and I guess the second thing, I talked to my dad this week, and I know you guys don't know my dad, but my dad is one of the nicest guys in the world, but he's like, I don't know about all this. I hear people talk about how bad they feel afterwards, and it can make me sick. So I have 2 people on here that have gotten the vaccine, both pharmacists. So be honest, when you got the shot, what was your side effect from it? Did you feel as bad as I said you're going to feel? Because the media has really talked about this a lot, about how bad you're going to feel. So Daniel, I know you've gotten both shots. Ashley, have you had both shots yet?
In a couple days, I get my second dose.
So you had your first dose. I'm going to start with you then. After your first dose, did you feel everything they said you were going to feel, or was it no big deal?
The only side effect that I experienced was having a sore arm, which is very common. Pain at the injection site was reported in, I think, about 80 to 90% of the recipients in the trials.
You're jamming a needle into my arm. Of course, there's going to be pain at the site. I mean, common sense now. Let's kick it in. All right.
That is not unique to this vaccine.
Right,
it's common with any number of ones, but that was really the only side effects that I personally experienced. I will say I felt a little bit more sore than some other vaccines, but then I spoke to other people who said, no, it was no different than getting a flu shot. There are some people who have some other symptoms like headaches and chills, maybe low fever and that kind of thing. So it can vary from person to person, but the side effects that we're seeing with this vaccine are largely consistent with a lot of others that are on the market as well. So I wouldn't say that they're unique necessarily.
All right, Daniel, you've had both. And I heard a rumor initially that the side effects were worse after the second dose than the first dose, which really confused my pharmacy brain because I really thought maybe it might be worse after the first dose. So you've had both. Tell me, was there a difference between the dosing and side effects?
So I agree 100% with Ashley. After the first one, my arm was sore. And And I related it to a tetanus shot. A tetanus shot in my mind versus a flu shot. The flu shot's, walk in the park. A tetanus shot leaves you like, yeah, I got something. Something happened. The second dose, I had a little same arm pain, but I had a headache and I just felt a little bit draggy. Now I will throw the caveat out there that my wife and I have a 5-week-old at home, so it may have been the child or it may have been the shot. But I agree with you. I mean, I've heard talk that the second dose causes a little bit more side effects, but really it's proving that you got something,
Right.
if you will, and at worst, it may cause a little bit of muscle aches and a headache for a couple of days, but it will go away.
So that was my question. How long, so you had a little dragginess, a little headache. How long did it last?
It lasted maybe, let's see, I got my dose at 10:30 on both the first day and the 21st day. And by 2 or 3, it was gone. And it was really interesting that it was almost
12
24
hours
then. It started about 24 hours after the fact. And then it hung out for, about 12 hours, give or take some.
So that's a good point. So you may not feel the side effect. It may be the next day that you feel the side effect.
Right.
And you're going to say something, I cut you off, but if you feel the stuff, it means the vaccine worked, right? I mean, we shouldn't get mad.
Right.
We kind of have a chill or a little bit of a dragginess to it, because that means that the immune system is doing its job.
Right. Your immune system's revving up and it's getting ready. And it will die back down. But I was going to say that, we always preach over and over that the flu shots cannot give you the flu. And the same exact concept applies here, is that, this is only just a snippet of coronavirus. It's not the whole entire virus in and of itself. This is just we call it a coronavirus because it has these cool spike-like projections, and they're called spike proteins, and it's just targeting one of those individual proteins.
Yeah, because I think the way the vaccine works, doesn't it kill like the protein? It spikes the protein or something like that. It's kind of
right.
cool.
So it targets the spike protein. Absolutely.
That's kind of cool when you think about superhero kind of stuff, that it, takes the spike out, if you will.
That's
I
right.
I like that. So,
new brand name.
we need to patent that quickly before somebody grabs on that.
That's right.
So, okay. So we've had people getting it. We know that it was in the works for a long time. So people who are worried about it coming to the market quickly, it really has been researched for longer than just these 6 or 8 months. Side effect wise, it sounds like, yes, you can have side effects, but if you get them, it usually goes away in about 24 to 36 hours once they start. And then this stuff works. We have good numbers to show that the immune systems respond pretty well with this. That's a good summary.
I agree. If I can go back and add one more thing to the rollout, throughout this whole time, there's always skepticism about it. But one of the cool things that these drug companies did was that while these studies were ongoing, they went ahead and made their stock, essentially. And so it was a combined effort, a sequential effort, if you will, or a synchronous effort, rather, that we were manufacturing it for the public, but we were also manufacturing for the trial and for trial participants. And so that way, once the FDA said, hey, you've got the green light, we already have a stock and it's ready to go, as opposed to the traditional route that you complete all the studies and then there's going to be a lag time that you're going to, as a drug company, manufacture the product.
That's a good point. In other words, the companies were taking it, they were really kind of crossing their fingers the FDA was going to let this go through, because they had full production starting. So they were making something even before they got approval. So they knew could have had to roll out faster. That's a really good point. So it cuts down the lag time. Yeah. And that lag time is important. I heard this morning from President Biden that the projection from the CDC is we're going to see about 500,000 deaths by middle of March, with projection out there. It floors me to think about that. So when we sort of talk about the number of infections out there, if you've had COVID, if you've had it and you've survived, should you still get the vaccine?
You are still a candidate to get the vaccine, yes, because right now we don't know exactly how long the immunity from an infection lasts. We have some pretty decent evidence showing that it's unlikely that you get reinfected within a few months. But you should still, if you've had coronavirus, get the vaccine. If you're actively sick with COVID-19, you do need to wait until you are well again and out of isolation to get it. but you are still a candidate if you have a history of infection.
I think that's an important point to make, because I know, Daniel, I know you, so many pharmacists have been through this, but I have you on this podcast, so I'm going to pick your brain. You were in the middle of a huge spike when this first happened. So are you finding that people who went through that spike, they're now seeking the vaccine, even though they were exposed or had COVID, they're still actively out there going, listen, I want this vaccine because I never want to get this again?
I wish I could say universally yes, but there's still quite a lot of vaccine hesitancy. I mean, there's still a lot of skepticism in terms of believing that it can come to market so quickly that, you always hear, oh, it takes 70 years to make a flu vaccine, and it's not that efficacious. But, when you think about the flu shot, we're combining 3 to 4 different strains within one vaccine, and it's a constantly moving target. Whereas the coronavirus vaccine is one virus. And even though it mutates, we can still cover it with that same vaccine. So I wish that I could say there was a higher uptake in terms of vaccines, and we've only been able to roll it out to healthcare workers, and then we've started to roll it out to healthcare workers within the community. But interestingly enough, when my wife got hers, the nurse that administered it had yet to get her vaccine. She said she wanted to wait and make sure that everyone else did okay, and I can understand that. But I think the benefits of getting it by far outweigh any risk that there is.
I think I want people to hear this, though, that if you've had COVID, you've tested positive, you were in isolation, you still need to put this on your to-do list, because what I'm hearing is this little son of a gun has mutated, and now there's like various strains from various countries, and right now the vaccine covers those strains. It just sounds to me like having this extra layer of protection against whatever may happen with the virus keeps you and your family safe. And to be crass, it helps the population, right? I mean, the sooner we get people vaccinated, the more we can look towards, I'll call the word normal, but whatever that means months from now, right? I mean, bell bottoms are coming back. How normal can it be? But yeah, I was joking with someone earlier that 2020 was a heck of a year, but 2021 is shaping up to be 2020 just with bangs, which is, for those who don't know, just a bad look. So one of the things that I want to bring back and talk about, and Dan, you said this a little bit, is talking a bit about the mutation and what's going on. This vaccine right now, and Ashley, please weigh in, this vaccine still covers those mutations, right? So I don't need another vaccine 6 months from now. Right now, this is taking care of it according to CDC and the experts?
Correct. So we talked about the spike protein in the vaccine. That's what the vaccine's targeting. And so the mutations aren't occurring at that spike protein. That spike protein is the same for all these variants. Whereas if you look at influenza, the targets that are within the vaccine are what's mutating. So that's why you're constantly having to chase it.
Okay. So right now, not only are we battling the original virus, we have a whole new wave of virus coming into the country that we need to battle. So that makes vaccinations even more important. I'm trying to let people know hesitancy. I think we all are scared at some point. But Daniel, you said this beautifully. The benefits of getting this vaccine outweigh the risk of getting the vaccine. And also, holy cow, the benefits of the vaccine certainly outweigh getting this stupid infection again, right? Tell me a bit about, if I get the vaccine, do I still have to wear a mask? I mean, if I get the vaccine, do I all of a sudden become super COVID boy, so I don't have to worry about this anymore? Or do I still need to go through 6 feet and mask and make sure I keep my family members safe and those around me? What should I do, Ashley?
You can still call yourself super COVID boy, but you still need to wear a mask and maintain social distancing. So right now we don't have data on how well the vaccines that we have prevent you from transmitting or spreading the virus to others. So it looks like they do a really good job of protecting you from getting sick, but we don't know if you're still able to potentially pass it on to others. And so until we know that with certainty, we're recommending that everyone continue to mask up, maintain social distancing, and everything else.
So continue with your precautions. So if I get the vaccine, though, I'm not going to give the virus to somebody else because they gave me the vaccine, right? Like I don't become infectious with the vaccine. Is that right, Daniel?
No, yeah.
Yeah, Daniel, true. You agree with Ashley?
I do. I
All right.
agree with Ashley.
But 100%, we 100%. All right. Because, I hear people say all the time, if you give me that and I get sick, I don't want to talk to somebody because I might give them COVID because you gave me the vaccine. That's not true, right? We're masking up because we're unsure about our interactions with other people right now. It's sad to say, but we get it, especially with the numbers that we're seeing. I was watching a program this morning and Dr. Fauci came on and talked about the fact that we're in a plateau right now, but that doesn't mean it's not going to spike again. So I don't want people to sort of sit back and go, oh, we're evening out. It sounds like we may be in for another spike. And as I mentioned, certainly we might see more folks not doing well with this, and our numbers may go up in terms of deaths in March. So that brings me to, all right, we've talked about it. We've yelled about it. We've given good examples. How the heck do you get it? You guys both have been vaccinated because you fall into the healthcare worker, right? So there's sort of a strategy about how we're rolling this out. Actually, I said earlier, we're in 1A, and you told me, no, we're in 1A plus, which sounds like I did really well on my geography exam. So what does that mean? Like, how are we rolling it out in sections to the various folks and people in the community?
That's a great question, because ideally we want as many people to get vaccinated as possible, but supply right now is limited. And so we have to find some kind of way to prioritize who should get it first. The CDC has put out some guidance on allocating the vaccine that's available and put people into different groups. And so like 1A, 1B, 1C, group 2. So 1A is healthcare professionals, and that's both people who are licensed, but then also support staff would qualify in that category as well. And then those who are in long-term care facilities. How were those tiers decided? There are really two main factors that led to that prioritization. So one is how likely is someone to come into contact or get exposed to the virus and potentially get sick themselves or spread it to others. So your exposure risk is one. The second main factor is who is most likely to get very sick and potentially die if they were to get the infection. So who's most likely to get exposed and who's most likely to have serious illness. And so with the healthcare professional, that makes sense. We come into contact with things like that all the time. We have a high exposure risk. With residents of long-term care facilities, while that's a really small percentage of the total population, that population actually accounts for about 30 to 40% of the total coronavirus deaths that we have seen. So if they get the illness, it is very likely to be serious in them. So that's kind of how the tier system was really decided. Now, it is up to the individual state if they want to follow exactly what the CDC has laid out, or if they want to do their own thing. So you'll see some variations. So some states are pretty much like, okay, we're going to follow the CDC all the way through, but then some are kind of doing their own thing. In the state of Georgia, we started with Tier 1A as recommended by the CDC. As of January 11th, we moved into 1A plus, which is a Georgia thing. So 1A plus, it takes everyone who is already in 1A, so long-term care facilities, as well as healthcare professionals, and it adds two groups to that. One group is law enforcement, which per the CDC, they're considered to be one of the frontline essential workers as part of 1B. So they kind of took a subgroup of 1B and moved it up to 1A plus, so law enforcement. And then the other group is adults who are age 65 and older. So now we have a much larger group in our state that are candidates for the vaccine.
Okay, so right now it's healthcare professionals, law enforcement, 65 and older, people who live in nursing homes or long-term care facilities are kind of in that first priority list that's out there. And so,
correct.
Daniel, I heard you mention this. You rolled it out to community healthcare workers in Albany. So you had the health system workers, and now you're working in the community. How do these people get it? I mean, I think some health systems have it for their employees, but let's say I'm 66 years old and I'm living in rural Georgia. I farm for a living. I don't live near a big town or a big health system. What do I do? I mean, I buy it. Listen, I listen to Dr. Hannings and Chastain talk. They have convinced me. They're brilliant. Now, where do I go get it? What do you tell that person?
So I think the easiest thing is, so since you listen to us, we're going to assume that you also have the internet. You're going to be a technologically advanced farmer. But the Georgia Department of Public Health has a what I think is a fairly comprehensive list of vaccine sites, and you can search by your county and figure out where it is. The easiest thing is the health department will have it as well. My parents live in a smaller county in very South Georgia, close to kind of what you were describing, but there were tons of wait times in terms of just being on the phone and trying to get someone to answer. So I think that more options are fantastic in terms of some of these community and chain pharmacies now picking it up. So just outside of a physician's office or outside of a Department of Public Health. But I don't think there's a universal statement of, oh, this pharmacy all across the state will 100% have it, because shipments aren't going to be consistent throughout every single facility across the state either.
So, okay. So the Department of Public Health, so you can get that. You obviously get on the internet. You can look at that. What you said is really important too. You can break it down by county. You can look at your nearest larger town around you. And so Ashley, Daniel mentioned some chain pharmacies. Is it okay are there certain chain pharmacies that have sort of taken the lead in this that we're familiar with their names that we can check to see if by chance they have any doses? Who would we talk to?
Yes, and that they do have that information on the Georgia Department of Public Health website that Daniel mentioned. So those sites are listed there as well. That is kind of changing over time. So, the vaccine first went to the major medical facilities in the health department, and then just recently has started getting out to community pharmacies. So there could be pharmacies that are getting it for the first time this week or next week. Publix and Kroger were among the first major chains to start getting the vaccine in. That doesn't necessarily mean that every single one of their pharmacies received a shipment, but they were, among the first. There were some independents who were in that category as well. So it does kind of vary, but it is becoming a little bit more widely available.
I think that's important to know. The reason I wanted some names out there is because they may not have it, but at least they may get it. So Kroger, Publix, I saw Ingles on a list for maybe those that live in various areas. So, looking at some of the larger chains, and then if you have an independent pharmacy that's owned by a local pharmacist and you know them really well, it might be worth a phone call to ask them if they're going to start carrying it. Because Daniel, you said this earlier, I grew up in a small town as well. And our local pharmacist was someone that used to help my family choose medications and get us through. Pharmacists have really changed over the past 20 years. A lot of pharmacists are licensed and equipped to give vaccines in their community pharmacies, in their retail pharmacies. So you don't have to go to your physician's office. You can actually get more than the COVID vaccine. So while you're there, you might be able to pick up several vaccines. Not to everybody wants to get a poke in the arm 10 times. But what I'm getting at is your family can actually go. It's not just one individual. You could take your family to a pharmacy if they have doses and you have the appointments, right? And I think they're doing appointments right now. It's not just, I can't just walk in, right? I need to follow the protocol or whatever they set for it.
Right. And that's a little bit different than how pharmacy-based vaccinations have gone in the past. It used to be to where a community pharmacy was one of the places where you could walk in and get care without having to make an appointment. That is not how it's working this time. You really do need an appointment. And that's because, with this particular vaccine, only select groups of people are candidates for it right now based on that allocation plan that's out there. So we want to make sure. Right. So we want to make sure that we're getting the vaccine to the right people. But then also both of these vaccines come in multi-dose vials. So there's multiple doses in a vial, but they don't have preservative in them. So what that means is that once I start using that vial, I only have a certain number of hours that I have to use all those doses in before the vaccine goes bad. And so this takes a little bit more planning on the front end than some of the vaccines we've had before, because we want to get it to the right people and we want to make sure that we don't waste any doses since it is in such short supply.
True. Now, Daniel, I know you're working in clinical practice in the health system. Have you been giving any doses in the hospital to people who've been admitted to the hospital?
We have not yet. I've seen some discussion about that on some listservs, but I don't think that I don't know if we have an answer for how that would work. And really going back to some of the stuff we mentioned earlier about how do we get you back for that second dose, or who becomes responsible for that second dose?
What I want people to hear is that really this is a community-based vaccine. So in other words, getting in the hospital doesn't get you the vaccine. It's much better if you start planning and looking around your community now, because that's where the bulk of the doses are going to be. I hear people all the time saying, well, I go to the emergency room whenever I'm sick. I'm sure they'll just give it to me while I'm there. That may not happen because of the way this is rolling out to much more a community effort, trying to get people in the door at local pharmacies, physicians' offices, departments of public health, those kinds of things. Is that a fair summary of how we see the rollout working?
I would say so. I think the other thing is that, in a lot of situations, if you're sick enough to be admitted, we may defer the vaccine anyways, because we don't want to cause too much chaos at one time and to confuse things in terms of what could happen. So I think just defaulting on, hey, I'm going to go to the hospital, hey, I'm going to get admitted, may not be the best option. You mentioned the president earlier, and I think that it's really encouraging in thinking about the gentleman who lives out in the rural area. There's some discussion about these pop-up vaccine sites and not even necessarily you having to go somewhere, but maybe it gets brought to you. And so that could be another avenue of potentially being able to get the vaccine.
Yeah, I read about that too and listened to the speech. I think you bring up a wonderful point. I think I just want people to realize sometimes when you got admitted to the hospital, we would give you your flu shot before you went home. That's not going to work here. That really the community effort is where you're going to get a play. You're not going to be able to jump the line just because you got to the hospital, basically. So think ahead, look ahead. And so as we sort of put this all together, I want to ask you guys, if you had to leave the community with 3 pearls of things that we talked about today, what would you tell those listening? Like, think about my dad, who, is kind of on the edge. He certainly fits the 1A+ category. Don't get me, and he's a smoker. So I worry about him even more. How would you convince him with 3 pearls to go get this done? Ashley, can I start with your first pearl?
Sure. I guess the first thing that I would say about the vaccine itself is that it's very effective and it's safe as well. And, it's been through the normal channels that we would see as far as vaccine approval. So there's been an FDA advisory group that reviewed the data, ACIP, which is a group that advises the CDC, looked at the data too, and the experts feel very good about what they have seen.
So this sucker is safe and it works.
Correct.
Give me another pearl, Daniel.
I guess I'll tack on to Ashley a little bit. I agree 100% with what she said, but you've also had every known skeptic under the sun, whether they're, homemade medical degree or a legitimate medical degree. Everybody's trying to pick this thing apart, but we're still seeing efficacy. We're still seeing safety. I've heard of all these crazy random ideas that are out there, and sure, somebody's going to come up with something that that doesn't necessarily make enough sense, but we'll have some believers. But I think if we as a community can come together and start spreading the truth and not believe what you see on social media, that hopefully that'll help us out in the long run.
Yeah, the Facebook physicians drive me crazy, and the Twitter pharmacists, a little bonkers. I think one of the things that's a really good point is trust your information, listen to what's being told to you. And also, if you don't like what we're saying today, talk to people you've worked with in the past that have given you health care and listen to them, whether it be that community pharmacist you've talked to or your primary care provider. That's good. And then so we've got this sucker works and it's safe. Don't trust fake news and stupid stuff. How's that for summarizing that one?
I like it.
What's another pearl, Ashley?
I would say one thing is, if you're not currently a candidate for the vaccine, I would say to just pay attention to the news, because as far as how we move through the different groups, that is actually going to be a statewide decision. So you won't have, or you shouldn't have, facilities that are just kind of doing their own thing. We're all kind of going in the same order. And so that information will be made public when it is your turn.
That's a good point. So in other words, stay on this.
Correct.
Don't sleep. Sort of stay. If it's not your time today, it may be your time next week. So things change quickly and stay up to speed. Very good. And then I'll do one more pearl from you, Daniel.
I think you tell your friends, you tell your family, and you encourage, I mean, again, as that community group, that, hey, I got it, I survived, now it's your turn. And so not only, I mean, you have essentially someone holding you accountable to go get it. That way, collectively, hopefully, as a community and as a nation, we can start, and as a world, really globally, we can start to move back to whatever that normal is going to be.
Oh, that's a good point. I think for me, if I had to give one pearl, just one, is quit thinking about yourself. I mean, I know we all have our own personal views about what's good and bad and what we do to our bodies. I get it. But I'm hearing news reports this morning that pediatric population and children are being impacted more by the mutated virus. This continues to evolve. And I think even if you don't buy it fully, buy it for your grandkids, your parents, your spouse, whomever you love. Just buy it, because it's not just about you anymore. It's about the global us. You guys have been great. And I thank you so much for coming on. I think one of the biggest things about this special edition is we're trying to really help the community understand that this vaccine could be the first step on us trying to find that path back to ball games and concerts and family gatherings and picnics and just going to the movie theater and having buttered popcorn with a soda. You know what I'm saying? I like watching streaming TV, but it really would be nice to go on a date and sit in a theater somewhere. So thank you so much, you two. You've done so much for the state of Georgia. I can't say enough thank yous for all of us, for all you're doing. Keep up all the work. And it's good seeing you guys, and Happy New Year.
Thank you too.
See you guys.
See ya.